Over 60. Warning. 7 early stroke symptoms from high blood pressure. If you're over 60, this video could be one of the most important health warnings you ever watch. Every year, high blood pressure silently pushes millions of seniors closer to a stroke, and most people don't realize it until it's too late. In the next few minutes, I'll reveal 7 early stroke symptoms that are often dismissed as normal aging, but in reality, they could be urgent signals from your brain and blood vessels. As a doctor, I've seen too many seniors ignore these signs, only to face devastating consequences later. That's why I urge you, watch closely, and if you notice even one of these symptoms, don't ignore it. Stay with me until the end, because knowing these signs early can save not only your brain, but also your independence and your life. Symptom 1. Sudden, severe headaches. If you're over 60 and living with high blood pressure, a sudden and severe headache is not something to brush off. Unlike the typical mild tension headaches that come and go, these headaches often strike out of nowhere, feel more intense than usual, and sometimes come with vision problems or nausea. From a medical perspective, here's what's happening. High blood pressure places constant stress on the arteries in your brain. Over time, those arteries become weaker and more fragile. A sudden spike in blood pressure can cause swelling in the blood vessels or even small ruptures, leading to what doctors call a thunderclap headache. This type of headache is a red flag. It tells us your brain is under dangerous pressure. Seniors often dismiss these headaches as just getting older or too much stress. But that's a mistake. I tell my patients, if you feel the worst headache of your life, especially if it comes suddenly, you must treat it as an emergency. It could be the very first sign of a stroke caused by uncontrolled high blood pressure. So what should you do? First, never self-medicate with painkillers and ignore the cause. Instead, check your blood pressure immediately. If your numbers are unusually high and the headache is severe, you need to seek medical care right away. Don't wait it out, don't assume it will pass. Every minute matters when it comes to stroke prevention. To summarize, not all headaches are harmless. For seniors over 60 with high blood pressure, sudden severe headaches are a flashing warning light from your body. Ignoring them could mean missing the chance to prevent a disabling or even fatal stroke. Symptom 2. Dizziness and loss of balance. Imagine standing up from your chair and suddenly feeling like the room is spinning, or you take a few steps and feel as if the ground beneath you is unstable. For seniors over 60 with high blood pressure, this is not just a sign of fatigue. It can be an early stroke symptom. Medically, dizziness happens because high blood pressure damages the small arteries that supply blood to the inner ear and the cerebellum, the part of your brain that controls balance. When those blood vessels are narrowed or weakened, blood flow becomes unstable, and your brain struggles to coordinate body movements. This is why patients often describe feeling like they are drunk or walking on a boat, even without alcohol. Too many seniors think dizziness is simply dehydration, standing up too quickly, or just part of aging. While those can be harmless causes, the real danger is when dizziness occurs repeatedly, lasts longer than a few seconds, or comes with blurred vision, slurred speech, or weakness in the limbs. That combination is a red flag for a potential stroke. If you or someone you love experiences this, don't brush it aside. First, sit down immediately to avoid falling and injuring yourself. Then, check your blood pressure. If it's elevated and you have additional symptoms, it's time to call your doctor or go to the emergency room. Stroke treatment is most effective in the first hours. Waiting could cost you your independence or your life. To summarize, dizziness is not always innocent. For seniors over 60 with high blood pressure, frequent or unexplained dizziness is often your body's way of telling you that your brain is not getting the steady blood flow it needs. Listen to that signal. It could save you from a devastating stroke. Symptom 3. Blurred or sudden changes in vision. Vision is one of the most sensitive indicators of blood flow to the brain. For seniors with high blood pressure, sudden blurriness, double vision, or even temporary vision loss in one eye can be a warning that a stroke is near. Here's why this happens. High blood pressure damages the tiny vessels in the retina, the back of your eye that sends visual signals to the brain. It also weakens the arteries supplying blood to the optic nerve and the occipital lobe, the brain's vision center. When these vessels are stressed or blocked, your eyesight can suddenly change, often within seconds. Patients often describe this as seeing a dark curtain fall over one eye, or objects appearing blurry and distorted. Some even notice bright flashes of light or sudden double vision. These are not just inconveniences, they are your body's urgent alarm. Many seniors mistakenly think these changes are due to just aging eyes or cataracts. While those are common in older adults, the danger is when the vision changes suddenly, without warning. That sudden onset is what separates normal aging from a possible stroke in progress. So here's my advice. If you suddenly lose part of your vision, even if it comes back within minutes, treat it as an emergency. Check your blood pressure immediately and seek medical attention right away. Doctors call this a transient ischemic attack or mini-stroke, and it is often a warning shot before a major stroke. To summarize, sudden vision changes are never just aging. For seniors over 60 with high blood pressure, your eyes can be the first window into your brain's health. Ignoring these signals could mean missing your one chance to stop a devastating stroke before it strikes. Symptom 4. Slurred or difficulty speaking. One of the most classic early stroke symptoms, and one of the easiest to miss, is trouble speaking. Seniors may suddenly find that words don't come out right. Sentences may be jumbled, speech may sound slurred, or they may struggle to find simple words they've used their entire life. Medically, this happens because high blood pressure damages the arteries that feed the brain's language centers, primarily in the left hemisphere. When blood flow is restricted or interrupted, the brain cells responsible for speech can't function normally, resulting in slurred or broken speech. Too often, families assume their loved one is just tired or maybe confused, but this is a dangerous mistake. Sudden speech changes are not normal aging. They are urgent red flags that blood flow to the brain is being disrupted, and a stroke may be underway. If you or someone nearby suddenly can't form words, struggles to speak clearly, or seems confused when trying to answer a simple question, treat it as a medical emergency. The rule we teach is simple. Time is brain. Every minute you delay, millions of brain cells may die. A practical test you can do right away is to ask the person to repeat a simple sentence like, "It is a sunny day." If they can't repeat it clearly or their words are slurred, don't wait, call emergency services immediately. To summarize, sudden speech difficulties are one of the most important warning signs of stroke, especially in seniors with high blood pressure. Ignoring this symptom could mean losing the critical window to prevent lifelong disability. Symptom 5. Sudden numbness or weakness in the face, arm, or leg. One of the clearest and most alarming signs of a stroke is sudden weakness or numbness in the face, arm, or leg, usually on just one side of the body. For seniors over 60 with high blood pressure, this is a critical red flag. Medically, this occurs because high blood pressure causes damage or blockage in the arteries that supply oxygen-rich blood to the motor areas of the brain. When blood can't reach those brain cells, the nerves that control muscles on one side of the body stop working properly. Patients often describe it as a sudden heaviness in the arm, a leg that won't support their weight, or one side of the face drooping. They may not be able to raise both arms evenly, or their smile looks uneven, one side lifts, the other side falls. Sadly, many seniors brush this off as just a pinched nerve or slept wrong. But when weakness comes on suddenly, without explanation, it is rarely harmless. It usually means your brain is under attack from reduced blood flow. A simple test we doctors teach is the FAST method: face, arm, speech, time. Ask the person to smile, is their face uneven? Ask them to lift both arms, does one drift downward? Listen to their speech. Is it slurred? If yes to any of these, it's time to call emergency services immediately. The reason urgency is so important is because stroke treatment is highly time-sensitive. Clot-busting medications only work within a few hours of the first symptom. Waiting too long can mean permanent disability or even death. To summarize, sudden weakness or numbness in one side of the body is not normal aging. For seniors with high blood pressure, it is one of the most urgent alarms your body can give. Take action immediately. It could save your ability to walk, talk, and live independently. Symptom 6. Sudden loss of coordination or clumsiness. Have you ever seen someone suddenly stumble, drop their cup of coffee, or have trouble buttoning their shirt, even though they were perfectly fine moments earlier? For seniors over 60 with high blood pressure, these are not just accidents. They can be early warning signs of a stroke. Medically, this happens because high blood pressure damages the blood vessels that supply the cerebellum, the part of the brain responsible for balance, coordination, and fine motor control. When those areas lose blood flow, simple tasks like walking straight, holding objects, or riding suddenly become difficult. Patients often say, "I felt like my legs weren't mine," or "I couldn't guide my hand." These sudden coordination problems usually affect just one side of the body, making the person appear clumsy or unsteady. Families sometimes mistake these changes as fatigue, arthritis, or even side effects of medication. While those can cause similar issues, the sudden onset and severity of clumsiness are what make it a red flag for stroke. If you or a loved one suddenly loses coordination, don't assume it's minor. First, help them sit safely to prevent falls. Next, check if other stroke symptoms are present like slurred speech, facial droop, or numbness in the arm. If yes, it's time to act fast and call emergency services. Doctors emphasize, when it comes to stroke, every second counts. A delay of even 30 minutes can make the difference between full recovery and permanent disability. To summarize, sudden clumsiness, stumbling, or loss of coordination is not just aging. For seniors over 60 with high blood pressure, it is your body's urgent alarm. Listen, act fast, and you may prevent a life-changing stroke. Symptom 7. Sudden fatigue or confusion. Imagine waking up one morning feeling unusually exhausted, or finding yourself suddenly unable to concentrate, remember simple things, or follow a normal conversation. For seniors over 60 with high blood pressure, these sudden changes in energy and mental clarity can be early signs of a stroke. Medically, this happens because high blood pressure disrupts the blood flow to the brain's frontal lobe and hippocampus, areas that control memory, attention, and decision-making. When blood supply falters, brain cells in these critical areas struggle to function, causing mental fog and sudden fatigue. Patients often describe it as feeling out of it or like their brain just shut down. They may sit quietly, unable to engage, or suddenly forget familiar names and tasks. Unlike normal tiredness that improves with rest, this fatigue feels overwhelming and comes without warning. Families sometimes mistake this as depression, stress, or simply having a bad day. While those are common in seniors, the danger is when fatigue and confusion strike suddenly and severely. That's when you must think about stroke. If this happens, don't wait for it to wear off. Check the person's blood pressure. Ask them a simple orientation question, like what day it is, and see if they respond clearly. If they can't, or if their blood pressure is dangerously high, it's time to seek emergency care immediately. To summarize, sudden fatigue and confusion are not normal parts of aging. For seniors over 60 with high blood pressure, they are urgent warning signs that the brain is struggling for blood flow. Ignoring them could mean missing the last chance to stop a disabling stroke. We've just uncovered the 7 early stroke symptoms linked to high blood pressure in seniors over 60. These include sudden severe headaches, dizziness, vision changes, speech problems, numbness or weakness, loss of coordination, and unexpected fatigue or confusion. Remember this: time is brain. If you or someone you love experiences even one of these symptoms, don't ignore it. Call emergency services right away. Quick action can mean the difference between full recovery and lifelong disability, or even life and death. High blood pressure doesn't always cause pain, but its damage is real and silent. That's why knowing and acting on these warning signs is one of the most powerful ways to protect your brain and your independence. If you found this video helpful, please subscribe, leave a comment, and share it not only for yourself, but to help other seniors who may not recognize these dangers. And don't go yet. In our next video, I'll show you the best daily habits to lower high blood pressure naturally and reduce your stroke risk even further. Stay tuned, and I'll see you there.